السيد رئيس الجامعة المحترم، السادة أعضاء الهيئة التدريسية المحترمون، السادة الحضور المحترمون، السلام عليكم. محاضرتي بعنوان Tuberculosis and Drug Resistance. Tuberculosis has been known to mankind since ancient ages. It commonly was known as consumption because of the pronounced weight loss that is caused. Other common names include wasting disease and white blood due to paleness of patient. Tuberculosis, discovered by Robert Koch, and he said the statements: if the importance of a disease for mankind is measured by the number of fatalities it causes, then tuberculosis must be considered much more important than those most feared infectious disease, plague, cholera, and the like. 1 in 7 of all human beings dies from tuberculosis. Robert Koch, in his address to the Berlin Physiological Society, 24 March 1882. يعني من ذلك الحين أدرك خطورة وشراسة المرض. What is tuberculosis? Tuberculosis is a bacterial infectious disease caused by Mycobacterium tuberculosis that are spread from person to person through air. There are 2 types of tuberculosis: pulmonary tuberculosis and extrapulmonary tuberculosis. Persons with TB can die if they don't get a proper treatment. Tuberculosis continues to be important re-emerging infections in era of AIDS. This explains why tuberculosis is an important disease. Tuberculosis is primarily a disease of men, occurs in locations where the transmission has been stable or increasing for many years. The incidence of tuberculosis is highest among the adults. Most cases are due to recent or reinfection, and higher proportion of cases are attributed to reactivation of latent infection. Priorities to control tuberculosis. Today's top priorities remain with diagnosis and treatment of identified cases. The global understanding leads to real plans to control the disease. The Stop Tuberculosis Partnerships Global Plan for 2006 and to 2015 calls for strengthening of laboratory networks to facilitate detection of all forms of tuberculosis, including smear negative tuberculosis اللي هو هذا نقدر نعتبرهم نار تحت رماد، يعني ينقل الإصابة وهو يعني يظهر كأنه healthy لكن هو يسوي showering للمايكرو أورجانيزم. Problems in diagnosis of tuberculosis. The persistent problem and difficulties in tuberculosis management in developing countries is based on there is no specific, no sensitive, no cheap and rapid method of diagnosis of disease. هاي مشكلة نعاني منها في مجال الصحة. The greater challenge in tuberculosis include the pediatric tuberculosis اللي هم يكونون أكثر عرضة للإصابة، هم وكبار السن. Drug-resistant tuberculosis and tuberculosis in association with AIDS. Resistant tuberculosis is a global problem. Global control of tuberculosis has been jeopardized by two major threats. The first one, HIV/AIDS. Two, drug-resistant tuberculosis. Drug-resistant and tuberculosis. Mycobacterium tuberculosis in nature resistant to certain antibiotics due to the presence of drug-modifying enzyme and drug efflux system and hydrophobic cell wall. The other problem, mycobacteria undergo natural mutations which can lead to development of drug resistance. يعني البكتيريا in nature, each one tubercle bacilli in million will evolve spontaneous mutation against anti-mycobacterial drug when it used singly. نشوف الفريكونسي مال الميوتيشن كلش بها عالي. TB is treated by administration of combination chemotherapy to reduce the probability of development of drug resistance. The combination in therapy is benefit to increase the rate of a cure to 95% or more. Development of increasingly resistant strains mainly due to patient non-compliance، وهذا عدم الالتزام بأخذ العلاج أحد المشاكل الرئيسية، بالإضافة إلى ندرة توفر العلاج في بعض المناطق من العالم. As you know, treatment include different lines. The first line drug are isoniazid, rifampin, beside pyrazine amide and ethambutol. The member of this line are bactericidal agents, kill active bacteria, and imported in early stages of infection, but not high effective in sterility. Second line drugs include kanamycin, carbamazepine, ethionamide, cycloserine, ofloxacin, and ciprofloxacin. The member of this line are more toxic and less effective. Should be used under strengthening conditions like treatment failure, multi-drug resistance, and so on. These members are bacteriostatic, hinder bacterial growth, strengthen treatment in the case of resistant bacteria, less efficient and generally more toxic than the first line drugs, but is more effective in sterility. Inappropriate chemotherapy, like monotherapy, single drug treatment, decreased treatment period, low absorption of drug, all these conditions lead to drug resistance. Drug resistance is a global problem. Some strains resist to one major therapy like isoniazid. Other resist to mainly treatment include isoniazid and rifampicin, and this strain is called multi-drug resistant. In 2005, in Africa, detected exclusively drug-resistant Mycobacterium tuberculosis strains. These include strains that resist to isoniazid, rifampicin, and fluoroquinolone, and at least one of the injectable drug of second-line treatment, like amikacin, carbamazepine, kanamycin. And even there is statement about total drug-resistant tubercle bacilli detected in some areas, and especially in Niger City. وللأسف أنه مثل هؤلاء الأشخاص لم يطبق عليهم قانون الحجر الصحي، وهم يتنقلون بحرية في المجتمع، وهم باستمرار في نقل العدوى. According to the latest World WHO statistics, approximately 500,000 new cases of multi-drug-resistant tuberculosis are diagnosed every year. Of these, it is estimated that approximately 40,000 have extensively drug-resistant tuberculosis. There is less than 6% of cases are thought to have been correctly diagnosed, due to limited laboratory capacity and lack of widespread drug susceptibility testing in resource-poor regions. In 2011, only 1 in 5 of the estimated drug-resistant tuberculosis